Welcome to Sense of Balance. I'm Phua from Sense of Balance, the acupuncturist. Today's topic is what is the chest pain cause? What causes chest pain? What causes chest pain is our main topic today. Now, if you're here, please give me a thumbs up and say hi to me, and as well as click the share button, share on to other platform. Thank you very much. Now let's start the topic today straight away, because after this I'm going up to Auckland to the temple, right? Put some music behind it. How do I do this? Oh, it's not yet. Okay. Now, most of the chest pain, right? When people tell you about chest pain, the first thing that we think about is, oh, heart attack, or angina. It's all related to heart, right? This is the first thing that we think about. But while chest pain is a well-established sign of a heart attack, happy day, but it can also be caused by many other less serious conditions. You know what it is? It can be just bronchitis, or injury, right? Or anxiety. The reason we said it's less serious, I mean, it's not going to take your life, but heart attack, it may kill you. Yeah. Good morning, happy day. Good morning, Norika. I'm good, thank you. All right. So about 13% of all emergency room, visits for chest pain result in a diagnosis of a serious heart-related problem. I want to list what sort of heart problem will cause this chest pain to you later. Okay, so this is 13% is according to the National Center of Health Studies, which is NCHS. Now, that causing things that causing chest pain, we're gonna discuss heart-related issues, gastrointestinal issues, lung issues, and muscles or bone-related issues, and other causes. The first one is the major one. Everyone knows about it. Okay, we talk about heart. The heart-related causes of chest pain. Well, what sort of heart disease can cause chest pain? Chest pain is a symptom, right? So it can come with heart attack, which is a blockage of blood flow in the heart. In the artery, the blood flow, the heart pumps the blood out to support the blood, the nutrients, the oxygen in the blood, and support everything to your body to function. The heart pump out, it got its own artery to support its own function, and that artery blocked, that causing heart attack. Angina, there's another one. Angina, which is chest pain caused by blockage in the blood vessel leading to your heart. That's another thing. Angina. Right. Angina. You heard a lot. And we talk about especially in Chinese medicine, we have this is called pericardium meridian in the middle over here. It go connect to your pericardium. And what's pericardium? A lot of people didn't know that, but with Chinese medicines and we're so familiar with pericardium, right? Even the doctor, family doctor, they don't talk a lot about pericardium. But in an acupuncturist mind, we always have pericardium, this particularly name in our brain. Yeah. Pericarditis is an inflammation of the sac around the heart, which is on the pericardium. So heart is heart. There's a sac, a tissue around the heart that is called pericardium. So inflammation in that causes pain as well. Myocarditis, which is inflammation of the heart muscle. The heart muscle is not a blockage, you still get the pain. And the pain is actually on the muscle, on the heart muscle. There's another one called cardiomyopathy. Cardiomyopathy, which is a disease of the heart muscle. Right? One is inflammation, the other one is disease. It's similar into the muscle, but it's different problem. Okay. IoT dissection. IoT dissection is a rare condition involving a tear of the aorta, the large vessel that comes off the heart. Wow. I do have some patients in the past that they had these issues. Okay. Malaria, you won't hear it all the time. Instead of heart attack in China, you hear that all the time. Okay. What others? So those are the heart disease that causing the pain, chest pain, the major one, right? Especially heart attack, angina. We heard it a lot, and they kill people. People die because of that. Okay. This is just disease that causing this symptom, but behind the disease, there's another cause of it. What's really causing of those things? All right. When it comes to heart attack and angina, we're gonna talk about those. Okay. There's a lot of topic we can talk about. One of the main issue for heart disease is actually the high blood pressure thing, high cholesterol thing. They're all related to diet. And for all those things, that Chinese medicine has a very, very effective way to treat it, to support it. Okay. Think about 1,000 years ago, we don't have Western medicine. How do we treat it? Chinese medicine, acupuncture. All right, we're doing this. Okay, gastrointestinal causes of chest pain. Now, acid reflux or heartburn, we call heartburn, is the acid from the stomach come up to your mouth along here, so you start to feel pain in here, especially burning. So not everyone get burning sensation though. Some will just get pain. Some actually get coughing, and that chest pain cause, it can be from acid reflux. Swallowing problem related to disorder of the esophagus. All right. So they have swallow problem and that food stuck there and it causing pain, and that's another reason. Gallstone. Well, gallstone causing chest pain. Well, where it's go? Gallbladder on that side, and the pain it can cause low back pain. It also can come up to pain over here, or across here, or cross over here. All right. So that's gallstone. Inflammation of the gallbladder or pancreas. So pancreatitis, inflammation in pancreas or gallstone, it can cause that problem too. Okay, now this is all the digestion system that causing problem that cause the chest pain. In acupuncture, acupressure, Chinese herbs had a very good, very effective way to treat heartburn, swallowing problem, go sorry. Got something going to my mouth. Then see what's going on. Got something suddenly into my mouth. Sorry about that. Okay. Lung related issues. Pneumonia. Pneumonia causes chest pain. Viral bronchitis causes chest pain. A blood clot in the lung, on a vessel, and stop the blood flow in the lung, and that causes chest pain too. Right. Bronchial spasm that causes chest pain too. Even a cold, a common cold, flu causes chest pain. You know, some people cough with chest pain. They cough too hard. Every time they cough, they got chest pain. So chest pain is just a symptom. Right. All these lung issues can cause chest pain. So we need to know, when it's chest pain, when it's lung related, we treat the lung. When it's from the gallstone, we treat the gallstone. When it's from the acid reflux, we treat the stomach. When it's from the heart, we treat the heart. It's so different. But when it comes to acupuncture and acupressure, heart attack killed my driver last week. Oh, I'm so sorry to hear that. Yeah. Veronica, I'm so sorry to hear that. So you see what heart is bigger issues causing chest pain and actually took life. It's much serious. Happy Day said, is there any other strategy to treat stomach also apart from the one you did on the video? Because I tried the video you did on stomach also, it didn't work. Can also cause chest pain? Yes, or stomach also can cause chest pain. Definitely. Tightness in the chest, not necessarily chest pain. It can be tightness in the chest. It cause acid reflux. Then acid reflux comes to the heart. It can cause tightness or discomfort or stiffness in the chest, or not necessarily chest pain though. It may be chest pain and or heartburn, and also stomach ulcers. Magical 8, magical 12 of acupuncture, you know, and tie in Yangming, that's including magical 8 and 12. And using magical 8 or magical 12, you can use image when there is a lot of symptom in there, right? And cupping on the belly button. And diet, stomach ulcers is diet, and stomach ulcers, when they come to the eat, it may cause bleeding in the bowel. It normally comes with black ones, not fresh blood. It's black color in the stool, and that is bleeding. Okay. Well, if it's causing vomiting, if it's very bad, it'll vomit blood, fresh blood, because it's on the upper digestion system. So what else can cause chest pain? So the thing that we named above, digestion, lung, heart, it's all organs. It's internal organs issues. Internal organ issues. What about not related to organs? Is anything else that not related to organs that can cause it? Yes. That is muscle related or bone related causes of chest pain. Bruises, broken ribs. Over here, under here, there's all ribs. Ribs are protecting our lung and heart, a sternum bone. You know, if you got hurt in the sternum bone, hurt on here, and got bruises in the muscle, and cause chest pain. And there's ribs broken, it causes chest pain. What else can cause chest pain? The bone over here, what they call it? I can't remember. Sunny blind folks, I can't remember the name of here. We call 锁骨 in Chinese. My mother has chronic stomach also. Yeah. So diet, changing diet is important. And some ulcers, they can't. Ulcers is funny thing, you know. Some of them, not everyone is same symptom though. Some of them, when they get hungry, they get pain. Some of them they eat, they feel better. And some of them they eat, and they eat a little bit more, they get worse. It's very complicated, and everyone's different. Okay, sore muscles form exhaustions or chronic pain symptoms. What chronic pain symptom can cause this? One of they call we talked about that already. Fibromyalgia. It can cause chest pain. It's not a heart problem. It's not a lung problem. It's the muscle. Yeah. What are the things like spine? Thoracic spine, it out of balance. The joint out of balance, it can cause chest pain too, because all this nerve that you can see over here, it control the chest. So those are spine compression or compression fracture. It can cause pressure on the nerve, on the spine, and cause chest pain. Okay. Dislocated subluxation. This is what do you call it? Chiropractor use the term of subluxation. Subluxation is that joint is out of balance. It's not on the right position, but it's not completely dislocated. It's not fracture, and we call subluxation. And the subluxation, it can cause chest pain because it's compressed on the bone, and therefore you need chiropractor, osteopath to put it back. But what other causes can cause chest pain? One of the common one, well, you don't see it a lot, but this is common causing chest pain too, called shingles. It's a skin problem, it's a virus issue, it's shingles. Very painful and a lot of burning sensation with that. Right, shingles, it's a virus issue. Right. So shingles can cause over here, and cause over here, and go down here to the back. It always go across. Something like that, right? Shingles virus is the same as chickenpox. The same virus. When you get it in the but different form. Same virus but different form. of disease. Another thing of emotional thing. What is emotional thing? Panic attack. Panic attack, you don't get any others. The panic attack is things that you don't don't necessarily have organs like heart attack or gut problem, like stomach problem or broken bone or muscle issues. It's just they have a sensation, they come in, they can't tell what's going on. Panic attack, they just have it, and they get chest pain and get palpitation, don't know what to do, and sweating and feeling cold. There's panic attack. Okay, so you see, chest pain is a symptom, but a lot of things. Clavicle, that's right. Thank you. Yeah, clavicle, and that is just broken, and that can cause pain in the chest as well. Right. Now, chest pain, you see, is a symptom, and it causes from many different disease. So treating it, you need to understand where it comes from. Of course, in acupressure point, we have some point that it doesn't matter what's going on, doesn't matter what's causing it. You use those points, it'll help, but it only helps the symptoms. Then we need to know what exactly the problem is. Then we can target it properly. So understand what is causing it is very important. When you know what's causing it, and when it comes to diagnosis, you can diagnose it properly. Then you can treat it properly. You can give your patient the best advice, the best treatment combinations. Right. So our treatments never just acupuncture or Chinese medicines. Our treatment always come with a combination treatment. Lifestyle changing, emotional daily practice, diet change, acupressure program that at home that you can do acupressure for yourself. This is what I do for my patient. I have diet advice, emotional daily practice, and acupressure program for all my patients. Right. How can you treat your chest pain? You need to know what meridian is there, which level. Then you'll be able to treat it. I haven't read your message yet. It's too many things that you type on. I haven't read it yet. Every day in the private message. Okay. Now, but in Chinese medicine, you need to know what meridian as well. And then when you want to treat chest pain, you need to understand what exactly causing of it, and then what you have to make a proper diagnosis of the proper diagnosis according to Chinese medicine. Then we'll be able to treat it. So I don't know about CV17. I'm pretty sure that CV is 1, but 17 I don't know whether. But it's anything that in here you can treat it in here. The scalp acupuncture over here or over here. Okay, the opposite. Okay, if sometime in the sternal bone, if that is bruised because you heard it from someone elbow, then we may be able to do some blood leaking in here. But it's not a lot of blood. It's just use lancet and step in here and cupping cup in here and take out the blood. Okay, if there is a bruise in here, if this is an injury, right, that may work for you. But try the scalp acupuncture for yourself, and the ear acupuncture on the over here. If you get the sensitive point, you can treat it too for that. That's all distal point, and over here there's some point that you can use. Just use massage device and get to the very sensitive one, and then put little needles in there. It can help in here and also over here as well. There are many ways to treat that. Right. Okay, that's it for today, and thank you for being here and supporting me, and I hope that this information give you some idea where the chest pain come from, and you as an acupuncturist, if you're an acupuncturist, you need to know what potential cause for chest pain. Then you need to make a proper diagnosis and be serious about chest pain. Be serious about chest pain. If it's a heart problem, then you need to treat it, because it may kill the patient. Right? Then diet changes must, and emotional daily practice is must too. Okay, stay awesome, and I'll see you tomorrow. Bye bye.